It started with a dream. A dream to help others.
When I first heard about the Pain Expo, since there had not been one before, it was a leap of faith for me as well. But I really liked the idea of a program that was organized by patients for patients in the area of pain.
But just being here and seeing all the people and the faces, everybody is so different with their pain. And just knowing that there's other people and other faces with the same pain helps. Thank you.
I thought I always was compassionate for patients, but I hadn't really had a lot of experience with dealing with patients outside of an acute care setting. What happens when they leave the hospital? How do they live their lives? And absolutely, I'm completely changed in the way that I'm going to approach patients and talk to patients as a result of this experience.
The only thing I can do is just talk to friends and family, and just to see other people in pain, it makes you be able to go through the day easier.
I really appreciate everyone that has come and has told their story, because I need to hear it, and I really appreciate what you're doing.
It became an event that changed lives that may not have ever changed, or taken years to do so.
Well, then I met Ro Jones, and as he said, it was about a year ago when we first crossed paths, and I saw someone whose passion and incredible enthusiasm was only to be outdone by his vision and desire to help put chronic pain on the map.
I've learned so much in this one weekend that I couldn't possibly learn from several books of reading.
I'm enjoying myself, these last 2 days with the information that I got from all of your speakers, and I hope that everybody had as much fun and learned as much as I did.
The biggest thing I think was bringing together so many experts in many different areas.
This is my home office. It's a very different, more relaxed environment than at work. And I sit at home and I ponder these issues.
Mrs. Jones, are you any better? Are you 20% better, 40, 60, 80, or are you 100% better? And after 8 weeks, 78% of my patients said that they were at least 80 to 100% better. Now, who was the most surprised by this? That'd be me.
If you're afraid to change, in the sport of swimming, you're going to fall behind. Just as if we're afraid to change because of our pain issues, we're going to end up falling behind. We have to do something different. We have to take risks.
Gold doesn't come out of the ground looking like it does in the jewelry store. It comes out of the ground looking like a rock, maybe with some little twinkling gold in it. And what they do is they take that gold and they put it into a smelter, and they heat the gold up to 1800 degrees. And then the gold separates and they skim off the top, something called slag. But what remains is this beautiful, refined, precious metal, purified, changed. I think chronic pain is a lot like that.
And I would argue we are the best educated society ever in the history of mankind. But it's all up here. We've intellectualized it, right? We all have that laundry list in the refrigerator at home. But deep down inside, we don't have that visceral understanding of what's going on. That's the transition. That's why we have to heal through understanding.
This is the start of really coming together. And so I just have a different take on what it's like to interact with patients with chronic pain.
I think it's very beneficial to me and to my patients.
I think it's incredible. It really is very much needed. There's so many people out there in pain, as you know. I'm so glad that you've decided to do this because, when you have an idea and you think about something and it reaches your heart and you know that you've lived it and you can touch so many people's lives, that's what it's all about. It gives you goosebumps.
I don't know if my goosebumps are going to go away.
I think that everyone can relate to overcoming challenges in life. And when someone eats away at you like a pain, a suffering, learning how to take care of your bodies and learn how the ways you can do it energetically, emotionally, to overcome these challenges in life is what is so important. And this is a phenomenal opportunity to learn just that.
I hope people really understand the vision that you and your wife have had in putting this on, because I can see how that vision is going to be helpful. Like I said, this is something that's not just helpful just to cancer, just to my daughter's very rare condition. This is people coming together with all different conditions that are dealing with pain. It is. I really appreciate your vision on this. You have no idea.
As an exhibitor, it's a wonderful showcase.
With my experience with a lot of the different trade shows that I've been doing, and I've done them for the last 10 years with this specific product, most of the shows are pretty big. I was really surprised at the size. Next year, this show, I only see it getting bigger.
And I want to come back next year, and I am going to do whatever I can to spread the word to not only physicians, but to the nurses and the pain community.
Fantastic response. I mean, lots of people are telling us what a great exhibition it is and how they've got so much useful information.
Well, I think this is wonderful. I just having a great time. I have seen so many beautiful people come by my booth.
If anybody doesn't do it that exhibits in this type of field, they'd be silly not to. So that's it.
We can tell more people about it, so it'll be just, bigger and better. I mean, this is the first year, and it's only can get better. And I'll be here next year.
So we set out on this mission to change the world of pain. And we look at Ashley and me, and we're two just little people. We're not doctors, we're not nurses or medical professionals. We're just two people who woke up one day and said, we want to change this. We want to make a difference.
Now I know this is the first Pain Expo, but let's stop for just a minute and imagine 10 years from now, when Pain Expos are recognized throughout this country as providing a valuable service to the pain community.
Suffering, of course, for me is not just feeling pain, but it's acknowledging that you don't control it all. And when you appreciate it at that level, you can share that with people around you that care about you and you care about them, you begin to change a lot of lives. And that happens best at an event like Pain Expo, where folks can get a little education, a little bit of emotion, and then get that cathartic process where they begin to ask, why do I have the pain? What does it do to me? How does it make me better? What can I do to change my circumstance? And you want that kind of dialogue. That's where true education happens. Not when I tell you something, but when you tell someone who loves you and trusts you something because you truly deep down inside believe it to be true. And that's what we're finding at Pain Expo.